Chronic kidney disease, CKD. It's an renal disease. Because this picture shows that normal kidney, diseased kidney, CT findings normal and diseased, ultrasound findings. A detail going on. Chronic kidney disease is a long-term condition characterized by the gradual loss of kidney function over time. The kidneys are responsible for filtering waste and excess fluids from the blood. Which are then excreted in the urine. When kidney function decline, waste products and fluids can accumulate to dangerous level, leading to various health complications. Definition: CKD is defined as abnormalities of kidney structure or function present for more than 3 months with implications for health. The most commonly used indicator of kidney function is the glomerular filtration rate, CFR, and CKD is classified into stages based on GFR levels. Types: CKD can be classified into 5 stages based on the severity of kidney damage and GFR levels. Stage 1: kidney damage with normal or increased GFR more than 90 ml per minute. Stage 2: mild reduction in GFR 60 to 89 ml per minute. Stage 3: moderate reduction in GFR 30 to 59 ml per minute. Stage 4: severe reduction in GFR 15 to 29 ml per minute. Stage 5: kidney failure, GFR less than 50 ml per minute, requiring a dialysis. Causes: the primary causes of CKD includes 1. Diabetes mellitus. High blood sugar levels can damage the kidneys over time. 2. Hypertension. High blood pressure can cause damage to blood vessels in the kidneys. 3. Glomerulonephritis. Inflammation of the kidneys filtering units. 4. Polycystic kidney disease, a genetic disorder characterized by the growth of numerous cysts in the kidneys. 5. Recurrent kidneys infections can cause long-term damage. 6. Obstructive uropathy, conditions that block the urinary tract. Risk factors. 1. Age. Risk increases with age. 2. Family history. A history of kidney disease in the family. 3. Ethnicity. Higher prevalence in African Americans, Hispanics, Asians, and Native Americans. 4. Cardiovascular disease, conditions affecting the heart and blood vessels. 5. Obesity can lead to diabetes and hypertension. 6. Smoking increases the risk of kidney damage. Complications. 1. Cardiovascular diseases, leading cause of death in CKD patients. 2. Anemia, reduced production of erythropoietin by the kidneys. 3. Bone disease due to disturbances in calcium and phosphate metabolism. 4. Hyperkalemia, elevated potassium levels can lead to cardiac arrest. 5. Fluid overload leading to swelling and high blood pressure. 6. Uremia, accumulation of water products in the blood. Pathophysiology. CDK involves a progressive loss of nephrons, the functional unit of the kidney. The remaining nephrons undergo hypertrophy and hyperfiltration to compensate, which over time lead to glomerular sclerosis and further nephron loss. This creates a vicious cycle of progressive renal damage. Signs and symptoms. 1. Early stages, often asymptomatic. 2. Later stages, fatigue, weakness, loss of appetite, nausea, vomiting, swelling, edema in the feet, ankle, itching, persistent high blood pressure, shortness of breath, changes in urination patterns. Diagnosis. 1. Blood test measures GFR and levels of creatinine and urea. 2. Urine test check for proteinuria, hematuria, and other abnormalities. 3. Image test, ultrasound or CT scan to detect structural abnormalities. 4. Kidney biopsy to determine the underlying causes of kidney damage. Nursing diagnosis. Fluid volume excess related to decreased kidney function. 2. Imbalanced nutrition less than body requirements related to uremia. 3. Risk for infection due to compromised immune response. 4. Fatigue related to anemia and toxin buildup. 5. Risk for impaired skin integrity due to edema and itching. Management. 1. Dietary changes, low sodium, low protein diet. 2. Medications, to control blood pressure, blood glucose, and manage anemia and bone disease. Three dialysis: hemodialysis or peritoneal dialysis in advanced stages. For kidney transplant for eligible patients. Treatment: one, lifestyle modification, healthy diet, regular exercise, quitting smoking. Second, medication: ACE inhibitors, ARBs, diuretics, phosphate binders, erythropoiesis stimulating agents. 3, regular monitoring, blood test, urine test, and blood pressure checks. Psychosocial medicine: 1, psychological counseling and therapy, cognitive behavioral therapy, supportive counseling. 2, support groups, peer support groups, online communities. 3, educational programs, patients education, workshops, family education sessions. For social work services, resources, coordination, advocacy, helping patient with 5, mind-body intervention, meditation and mindfulness. Prevention: 1, control blood pressure, regular monitoring and medications. 2, manage diabetes, keep blood sugar levels under control. 3, healthy lifestyle, balanced diet, regular exercise, and avoiding smoking. For regular checkup, especially for those with risk factors. In conclusion, CKD is a significant public health issue with serious health implications. Early detection and management are crucial to slowing disease progression and improving quality of life. Comprehensive care, including medical treatment, lifestyle modification, and psychosocial support, is essential for managing CKD effectively. Thank you. Have a nice day.